thing to remember here is the physician has control over the entire interaction. Physicians are not powerless. If they accuse reps of telling them what they want to hear, tell the rep what they want to hear. Yeah, sure, love your product, prescribe it all the time, give me a ton of samples, and then give it out to whomever you want or use it how you see fit. They determine how the samples get used, and they determine whether or not, we even have gen.
But I certainly think you're right to some extent. I mean, it is a double-edged sword. I think in a lot of cases the doc has power, but you can, if you've got a connection with a physician and you've been seeing him for about 6 months to a year, and you guys are connected, he's going to have a hard time if you come in there and say, I have 24 samples for you. The first 20 are for your regular patients. These 4 are the patients for anxiety. You're going to use that specifically for new anxiety patients, and he agrees to you. You can browbeat him into submitting. You can do it with some physicians, and that's just one example. I mean, there's plenty of ways you can leverage your relationship with him to make sure that he either he acquiesces or he follows through with whatever he agrees to.
You got to remember, we're the ones knocking on his door.
Right,
not vice versa.
But we're also the only ones walking into his office who isn't asking him to heal us or who isn't asking him to fill out tons of paperwork. We're his buddy, and he is happy to see us at the end of the day.
Well, yeah, some of them are.
Some of them, you're right. You're right. You're right. And that's certainly the case with a bunch of docs that I've had.
Oh yeah.
They brought me into the office, and one told me, take a good look around. And I did. And he said, good, that's the last time you're going to see my office. And they booted me out. and so, yeah, doctors do have this sway. But like you said, some doctors don't mind being manipulated. And some doctors don't realize they're being manipulated. When it comes to like drug reps, I mean, sometimes they're, they get this sort of seedy side to them where they put down their humility just so they can milk you for all the pens and samples that they can get. Some of them do that, and then the other ones are just like, they maintain that air of arrogance or entitlement and expect you to give everything to them, and without offering to listen to what you have to say or anything.
I tell you, I try not to be too judgmental about the 30 seconds that I get in front of a physician. And what it comes down to is, I remember one of the first calls I made was on a physician, and he is a definite, a certain style of physician, and it was just cold, and I was really angry. But you want to know what? I went to about 2 other physicians later on, and we got talking about that. And they're like, well, and I guess the guy does like pro bono work all over the place. He's huge involvement, and really he's overall a great guy, really nice guy. The fact is if they treat us like dirt, if they treat me like dirt at times, that's something that I accept, because I am there ultimately because I want to make money too. Right. But there's other things that come with that. They hire us to be salespeople, but how you sell a product, and this depends down to the rep. They give you leeway. So, you can be total sales, tell them whatever they want to hear. But if you really want, the other thing is again, don't count out the physicians. The physicians, when they find out that you're just telling them a bunch of malarkey, they're gonna call you on it. If you show up and get your face in front of the physician and just say the product, it just goes back to the ancient days of advertising. You throw that name out there enough. It's just like politics. You throw out enough about a certain candidate's name. Have people vote based on name recognition.
Absolutely.
So, and so I think, especially in certain specialties and stuff like that, where only certain names are mentioned over and over, obviously that has an effect on how they prescribe. Have I seen it happen? No, I haven't ever seen anybody promote off-label specifically. But I know it's out there, and the problem with it is this: whatever the FDA approves is what you're allowed to talk about. What's in the PI is what you're allowed to talk about. What's on your detail aids that's FDA approved is what you're allowed to talk about. But there are certain instances where other physicians are using a product. All of our ED products a lot of them were tested on in heart patients and stuff like that for different types of indications. Well, if another doctor comes up and says, well, I use that for erectile dysfunction problems, and the FDA hadn't approved that, and if I say that, then we're in trouble. So, a lot of times off-label promotion becomes talk to so-and-so physician. And that's where the gray area is. The doctor themselves will have to talk to that other doctor because they can talk on a level supposedly that we can't because we aren't medically trained. At least I'm not.
Right. But
and,
that's I was going to say, that's where you can recruit him as a speaker and get a good dinner meal out of the whole thing too. Exactly. Get a dozen doctors together and say, hey, Dr. Jones here uses it for erectile dysfunction. Check this out.
Yeah.